Hey everyone, and welcome back to our channel. I am Lakhan Dalwani, your go to health consultant, sharing expert tips to help you understand and take control of your body's health. So, today we are diving into a topic that many women experience but may not fully understand. Yes, we are talking about period blood clots. If you have ever noticed clots during your period and wondered, is this normal or should I be worried? This video is for you. We will break down what blood clots are, why they happen, and when they might signal something is more serious. So let's get started. Okay, first let's start with the basics. Period blood clots are exactly what they sound like, clumps of coagulated blood that sometimes pass during menstruation. And guess what? They are actually more common than you might think. So, what are period blood clots? When we menstruate, our body shades the lining of the uterus, called the endometrium, along with the blood. Sometimes, if the flow is heavy, the blood pulls in the uterus and starts to clot before being expelled. These clots can vary in size from as small as a sesame seed to as large as a quarter. This happens because of a natural process called coagulation, where the body tries to stop blood loss by thickening or clotting it. But the important thing is, in most cases, these clots are a normal part of a menstruation, especially on heavier days of your period. So you might be getting a caution, so you should be concerned about blood clots during your period. So most of the time the answer is no. However, there are a few signs that could indicate something more serious is going on. So here are some red flags to watch out for. First is unusually large clots. Anything larger than a quarter may be a sign of something like fibroids or polyps, which can cause heavier bleeding. Second is very heavy bleeding. If you are soaking through a pad or tampon in less than an hour for several hours in a row, this could be a condition called menorrhagia or abnormally heavy bleeding. Third sign is severe cramping or pain. While some cramping is normal, intense pain combined with clots could signal conditions like endometriosis or adenomyosis. And fourth sign is changes in your cycle. If your period suddenly changes in flow, clotting, or duration, and it's not typical for you, if you are experiencing any of these symptoms or have any concerns, feel free to drop a comment below, and I would be happy to provide more advice based on your situation. Now, let's talk about some of the potential causes of abnormal clotting. Some common reasons include fibroids. These are non cancerous growths in the uterus that can cause heavy periods and clotting. Second is hormonal imbalances. Conditions like polycystic ovary syndrome, also known as PCOS, or thyroid problems can throw off your hormonal balance, leading to heavier periods and more clots. Second is endometriosis. This is when tissue similar to the lining inside your uterus grows outside of it, which can lead to heavy bleeding, clots, and significant pain. And last is miscarriage. Sometimes clots can be a sign of early pregnancy loss, especially if the clots are accompanied by other symptoms like severe cramping or pushing tissue. I know some of these signs sound scary, but don't panic at all. If you are noticing any of these symptoms, it doesn't automatically mean something is seriously wrong. However, if you are concerned about any symptoms, feel free to reach out and I can help you understand what steps you need to take next. So, how do you manage period blood clots? Well, for most women, it's all about tracking your cycle and understanding what's normal for you. Here are a few tips that can obviously help. First is tracking your periods. Apps like Clue or Flow can help you monitor your cycle, indicating when you see clots and how heavy your flow is. Second is stay hydrated. Drinking plenty of water can help thin the blood and also reduce clotting. Third is having iron rich foods. If you have heavy periods with clots, you might be losing a lot of iron. Try to incorporate foods like spinach, lentils, and red meat into your diet daily. And fourth is consult your doctor. If you are concerned about clots, especially if they are large, painful, or accompanied by other symptoms, make sure to check in with your healthcare professional. It's always better to be safe, educated, and get an expert opinion. So, alright, that's a wrap for today's video on period blood clots. Remember, some clotting is totally normal during your period, but if something feels off, different, or bizarre, it's always okay to check with your doctor. So don't forget to like, share, and subscribe for more health tips and advice. And also press the notification bell so you never miss an update. Also share this information with those who need this badly. And thanks for watching, and I will see you in the next video. Until then, stay healthy, stay happy, and thank you again for watching.